Thank you so much, Stephanie. Let's go ahead and get the show on the road here. I'm going to spend the next half hour just first providing a brief overview of the national landscape of smoke-free laws that regulate multi-unit housing settings. And while the focus today is on voluntary policies, it's still important to get the lay of the land when it comes to what laws are out there that do regulate these spaces. So next, I'll then cover different policy options for voluntary policies, ranging from simple smoking policy disclosures to comprehensive smoke-free policies, and then highlight some key elements that should be considered when crafting a smoke-free housing policy. And then I'll conclude with some practice pointers on adoption, implementation, and enforcement of a smoke-free multi-unit housing policy. And then with whatever time we have left, I'll try to answer any questions you may have. So again, as I'm presenting, feel free to post in the Q&A section or in the chat any questions you might have, and I'll do my best to address as many as I can. But first, very briefly, the Public Health Law Center is a nonprofit organization housed at the Mitchell-Hamlin School of Law in St. Paul, Minnesota, and which is situated on the traditional homelands of the Dakota people in an area known as the Bdote region. Our work centers on commercial tobacco control, healthy eating and active living, climate justice, and public health infrastructure programs, which include attorneys, policy analysts, and support staff, all working together to improve public health through the power of law. Health equity always plays a role in our work, meaning that when we're helping to craft various types of public health policies, we strive to be mindful of several factors that influence public health, including housing, education, the environment, and a variety of other social determinants. We never want to offer policy solutions that would cause someone to lose their housing or their employment and then subsequently have a negative impact on their health. We provide free legal technical assistance nationwide on policy issues, including commercial tobacco control. We also do legal research and analysis and provide publications, trainings, and webinars. We do not, however, provide client representation, which includes the giving of legal advice, nor do we lobby elected officials. If there's a particular area of tobacco control policy or other public health policy related to other programmatic areas that you're working on and would like assistance with, please do not hesitate to reach out to us. So let's go ahead and dive in, starting with that brief overview of what's going on nationally with smoke-free housing laws and policies. So smoke-free housing has been and continues to be a growing trend. About 20 years ago, there were virtually no smoke-free policies in place for multi-unit housing. But today you see more and more properties that are smoke-free, which is good news. A lot of this success is, of course, attributable to the overall decline in smoking rates and a shift away from smoking in general, which in turn has paved the way for multi-unit housing property owners to go smoke-free. And from a regulatory standpoint, the U.S. Department of Housing and Urban Development has also played a key role in promoting smoke-free housing as a result of the HUD rule, which since July of 2018 requires that all public housing properties across the United States be 100% smoke-free. It's estimated that because of this rule, about 2 million Americans, including 760,000 children, are protected from exposure to secondhand smoke. The rule does not extend to Section 8 housing since those properties are privately owned, even though rent for those properties is subsidized with federal funds. But the big picture is that there has been momentum following the implementation of the HUD rule with respect to adopting smoke-free policies in multi-unit housing. And this is true for both public and private housing. So with respect to private housing, smoke-free policies usually take the form of voluntary policies that are implemented by a landlord, homeowners association, or other property owner or property management entity. And as I said, that's our main focus today. And the reason why we focus so much on voluntary policies is because state or local clean indoor air laws that we know prohibit smoking in public places like restaurants, bars, hotels, public transportation, healthcare facilities, and so on, do not cover multifamily housing settings. So when you take a moment and think about that, it means that our homes, if you live in an apartment or condo, are the last places that are not regulated by clean indoor air laws, which in a way kind of seems counterintuitive, especially since you're supposed to be the safest in your own home and free from the harms of secondhand smoke exposure. That said, there do exist municipal ordinances regulating smoke-free spaces in multi-unit housing. As of April 1st of this year, there are 101 jurisdictions that have enacted a law at the city or county level that prohibits smoking in 100% of private units of multi-unit rental housing. Of those 101 jurisdictions, 51 have the strongest best practice laws requiring all multi-unit housing to be 100% smoke-free indoors without any exceptions. So that's going to cover both rental and owner-occupied properties with 2 or more units, and include the prohibition of both the smoking and vaping of tobacco products as well as the smoking or vaping of cannabis. Note that all 101 jurisdictions with ordinances currently in place are in cities or counties located in California. Hopefully that will change over time and more local jurisdictions across the country will pass ordinances that regulate multi-unit housing settings. And you can see on this slide, the American Non-Smokers' Rights Foundation regularly monitors jurisdictions that pass smoke-free multi-unit housing ordinances. And it's just a really great user-friendly resource that lays out every local law regulating smoking in multi-unit housing settings and provides things like details, including effective dates, the minimum number of units that are subject to regulation, any exemptions for existing residents, and so on. So do check out this really great resource if you're interested in taking a deeper dive into these laws and how they might differ from one another, or just to see what's happening in your community. So at the state level, there are no comprehensive clean indoor air laws that regulate multi-unit housing anywhere in the country. Some states, like our home state here in Minnesota, do regulate multi-unit housing, but in a very limited way. In our state, smoking and vaping is prohibited in common areas of rental housing, which is good, but ultimately it's quite limited in scope, since smoking and vaping is not regulated in private units of rental housing or regulated at all in owner-occupied multi-unit housing like condos and townhomes. And it's against this backdrop of the regulatory void left in state law, and that because, at least for now, cities and counties are unlikely to enact ordinances, where we find that voluntary smoke-free housing policies become all the more important. Voluntary smoke-free policies are entirely legal, no matter what state you're in. Smoking and vaping are not protected rights. There's no constitutional or other legal right to smoke. And smokers are not deemed to be members of a protected class under federal or state law. So property owners are free to adopt strong, comprehensive smoke-free policies. That said, I do really want to emphasize that the policies we craft or other comprehensive and public health protective policies are about regulating smoking and eliminating exposure to secondhand smoke, and not used to target or be weaponized against smokers. The intent of these policies is not to punish smokers. And in fact, when crafting comprehensive smoke-free policies, it's important to take into consideration the very powerful hold that nicotine addiction has over people, which is why it's important to ensure access to cessation resources as part of any policy enforcement that can maybe help smokers try to quit. So in addition to the public health benefits of going smoke-free, it's just good business to have a smoke-free policy in place in all housing settings. And we've known for a long time now, since at least the 2006 U.S. Surgeon General's report on the health consequences of involuntary exposure to tobacco smoke, that there is no risk-free level of exposure to secondhand smoke. And that SGR noted that secondhand smoke can travel from unit to unit through doorways, windows, light or electrical fixtures, shared ventilation, or even small cracks or crevices in walls between units. So completely eliminating smoking in indoor spaces is the only sure way to protect against exposure to secondhand smoke, since separating smokers from non-smokers within the same building will not solve the problem, since people will continue to be exposed to secondhand smoke. And smoking in housing units also poses a heightened risk of exposure to third-hand smoke, which you can see in that picture what third-hand smoke residue looks like. It's pretty gross. And it consists of the tobacco pollution that persists in the air and on surfaces. And the residue also sticks to and becomes embedded in drapes, carpets, walls, and furniture. So the costs associated with property remediation can be quite high. Third-hand smoke also produces chemicals that are re-emitted into the air and then thereby exposing residents to toxins that are contained in third-hand smoke simply by touching contaminated surfaces. So given that both secondhand smoke and third-hand smoke cause property damage requiring remedial repairs, it's clear that going smoke-free is it is in the best business interests of property owners and not just residents, because it lowers overall maintenance costs and also increases the overall value of the property. So let's go ahead and focus on different policy options for smoke-free housing policies, as well as some of those key elements to those policies in whatever form they may take. And there are several different kinds of voluntary policies, ranging from basic disclosures to comprehensive smoke-free housing policies, each with their pros and cons. The first one, in which a landlord or HOA provides a smoking policy disclosure to a prospective tenant or condo owner, is the least effective from a public health standpoint. While it does allow someone looking for a home to make an informed decision on whether to rent or purchase in a building in which smoking is permitted in all or even certain common areas, ultimately, these disclosures aren't going to provide smoke-free environments, as they're the weakest policy option, since all they really do is just simply inform prospective residents of a building's smoking policy and lack any enforcement mechanisms. The next policy approach is through a lease addendum, and this allows landlords to phase in smoke-free policies as leases are renewed. And that can usually make implementation of the policy easier as residents adjust to living in a building that is shifting from allowing smoking to prohibiting it. Of course, with a lease addendum comes accountability. If a tenant smokes in her apartment, it's going to be a violation of that lease, which can then include possible lease termination and ultimately, of course, eviction. One of the disadvantages of a smoke-free lease addendum is that it can be used and is often used in some certain circumstances as a tool by a landlord to target for eviction tenants they don't like. And to that end, we don't discourage use of lease addenda, but rather these should be utilized in a manner that is mindful of how it can be used disproportionately to evict, in most instances, historically marginalized and other vulnerable populations. And the Public Health Law Center has developed a model lease addendum for communities in New York State and in Minnesota, but those can be helpful as a resource for properties located anywhere in the country. Our model lease addendum is comprehensive as it prohibits smoking and vaping on 100% of the property grounds, but it can also be modified in any way that best fits or suits the particular needs of a property. It's always important I will say, if you go off our resource or any other policy, it's always important for a property owner to consult with an attorney licensed in their state to review any lease addendum before implementing it, whether it's based off our model. The third policy approach is for a property owner to have a smoke-free policy in place, but to provide a designated smoking area on the property grounds outdoors. And while DSAs are not ideal because residents and guests can still be exposed to secondhand smoke, they can allow for easier implementation of a property that is transitioning from allowing smoking in the building to prohibiting it. If a DSA helps gain compliance among residents, then it's definitely going to be a factor weighing in favor of having these on your property. In our model policies, we do include very limited designated smoking area language as an option if this is something that a property owner wants to pursue. It allows for a designated smoking area, but it does keep it very structured and as protective as possible. So we're talking at least 25-foot buffers from any entryway, exit, or windows, as well as not located near other outdoor common areas like pools or playgrounds. And there'll be, of course, very clearly marked perimeters. And finally, the last and best approach is to adopt a strong, comprehensive smoke-free policy on 100% of the property grounds, both indoors and outdoors, and with no exceptions. Generally, these policies are intended to fully protect residents from any secondhand smoke exposure, a policy like this will have clear, graduated enforcement provisions that are intended to provide clarity, as well as close any loopholes so that both the property owners and the residents fully understand the policy itself, who's in charge of enforcement, and the consequences for non-compliance. And there are some key policy components for property owners to weigh when crafting a strong, comprehensive policy. And some of the areas to consider when piecing together a policy are going to include factors such as, first, what existing laws already apply? Looking to your state's laws and filling in those gaps left out of those laws. As I mentioned earlier, most state clean indoor air laws do not cover multi-unit housing settings at all, or cover a very limited area like common areas of rental housing. So a property owner can craft a policy that is intended to fill in those gaps. A comprehensive policy should also cover the range of products and substances, so that smoking and vaping of not just tobacco, but cannabis products as well is covered. Also, as I said, vaping ends products, you want to make sure electronic delivery devices are covered in the policy. And then moving on to scope, that should absolutely be considered as well. Will the policy cover the entire property or allow smoking on the grounds in the form of a designated smoking area? And then you'll get to the when. That should be factored in, and this means clear communication early on and engagement with residents. These have proven to be key factors for the successful implementation of the HUD rule back in 2018. So let's learn from that experience. And then finally, of course, is enforcement and the considerations that go into that. Again, eviction is not the goal of the policy, so graduated enforcement is going to be the recommended approach. So moving on to how best to adopt, implement, and enforce a comprehensive smoke-free multi-unit housing policy. There are pros and cons for adopting one, depending on what type of property we're talking about. For rental communities, there will usually just be one decision maker, and that's the owner of the property or management company. So it's going to be easier to adopt a smoke-free policy for that reason, right? The lease structure is going to determine adoption and implementation. So a smoke-free policy can be relatively seamless, a phased-in approach, where as residents renew their leases, the policy will then become effective at renewal. In condos and townhomes, on the other hand, there are many owners, right? And so as a result, there's going to be many decision makers. And that will mean that any change in policy will take time and resources. The Homeowners Association documents will determine how the policy is adopted and implemented. And usually that's done either with the policy becoming part of the declaration and the bylaws, which would come about by either a majority vote of the property owners or by a majority vote of the association board. We get a lot of questions about whether it's better to include a smoke-free policy in the declaration or should we just change the rules? And that decision will depend on whether there's broad support for policy change by association members versus an expectation, say, that if that policy is enacted, that it might be subject to legal challenge by one of the owners. So a change to a declaration is going to be more difficult to pass, but as a result, the courts will give it more deference if it's subject to a legal challenge and therefore better able to withstand that legal challenge. On the flip side, just implementing a new rule is much easier to implement as well as to amend, but also it's going to be more susceptible to a legal challenge than a declaration is. Implementation of the policy will also vary depending on whether the property is rented or owned. So for rental communities, the smoke-free policy will be implemented and enforced by the landlord or property management company. And consideration of concerns like housing stability does require a more graduated enforcement approach rather than just first resorting to eviction against someone for a policy infraction. For owner-occupied properties, any smoke-free policy will be enforced by either a management company or the community association. And graduated enforcement is also considered a best practice here so that we're ensuring housing stability while promoting clean air for all. And here's what I mean by graduated enforcement. Again, because nicotine is an incredibly powerful and addictive substance, the principle underlying graduated enforcement is to approach implementation of a smoke-free policy with an eye toward assisting residents with compliance. And that means offering assistance when it comes to addiction. And that's why graduated enforcement will include multiple steps before eviction or other penalties are pursued. And these include steps requiring education of the policy and over communication of the policy, and then followed by offering cessation resources. This more comprehensive approach helps promote housing stability for all residents because people will then have the opportunity to know what is expected of them and then make clear choices. And there are many different models of graduated enforcement, and several are included in our publications. Again, our model policies for both rental and owner-occupied communities are state-specific. However, they can be very useful as a resource or used as a template for policies implemented in any jurisdiction. And of course, as I said earlier, an attorney licensed in your state should review any policy before it's adopted and implemented to ensure that it complies with state and local law. And you can see on this slide, there are a series of warnings, verbal and written, with subsequent violations, as well as the provision of smoking cessation materials that is part of the graduated process of enforcement. For rental properties, you can use what's known as the day fine method, which assesses fines based on a tenant's ability to pay rather than a flat and often steep fine. Another option is a voluntary policy can leave out the assessment of fines entirely if there's concern about any unintended consequences of throwing particularly low-income residents into a financial crisis, leading to possible housing instability, especially if they can't afford to pay those fines. On the other hand, in the context of owner-occupied communities, like condos and townhomes, the imposition of fines are a frequent enforcement tool for all sorts of policies in place, not just smoke-free ones. And that is considered to be an acceptable mode of enforcement. And finally, any comprehensive policy with graduated enforcement provisions should always provide cessation resources to residents who are in violation of the smoke-free policy. And again, a smoke-free policy is not designed to force people to quit smoking, but the policy will be stronger and more successful if resources are at least provided that can help residents who are struggling with addiction. And you'll see on this slide, there are some quitline and other cessation resources to promote as a good starting point. I will point out that given the recent cuts in federal funding, there are several states at risk of losing their quitline services, which is extremely unfortunate as well as discouraging. But I mention that just because property owners should make sure that any cessation resources that are part of the enforcement of their smoke-free housing policy are in fact still in existence and up to date. And this slide shows a couple of our resources that may be helpful to you. Again, our model condominium policy and our model lease addendum in particular. And the third document on the right is our fact sheet on equitable enforcement in the context of smoke-free multi-unit housing, and provides extensive information, including the rationale behind graduated enforcement provisions. And the links to these resources are all on these slides, which will be made available in the next day or two on our website. And on this slide, you can see we have several more publications that pertain to smoke-free housing and more generally. So these are going to range from creating affordable smoke-free housing, smoking policies pertaining to cannabis use, and disclosure of smoking policies, just to name a few. So go ahead and check those out. They're all available on our website at publichealthlawcenter.org. And as I said in the beginning of this webinar, we are available to provide free legal technical assistance if you're looking to put together a comprehensive smoke-free housing policy for multi-unit housing property wherever you are located. So again, don't hesitate to reach out to us. And with that, we can open things up to address any questions anyone might have.
Yes, Marisa, thanks so much for that awesome presentation. We do have a few questions in the queue here. One is asking about, can you explain why a smoke-free policy that prohibits marijuana use is legal if the resident is a state-registered medical use patient?
Yeah, that's a great question, and it's a hot topic and one that gets raised a lot. Again, as I said earlier, any policy that prohibits the smoking or vaping of cannabis, including medical use of cannabis, is legal. Medical marijuana is legal in 38 states, so it's definitely out there and it's happening. And we often hear arguments that that state-registered medical marijuana users, either do or should make up a category or class of people deserving of protection against discriminatory practices or laws that restrict their ability to smoke cannabis medicinally. And that's especially the case if the reason someone uses medical marijuana is tied to a disability. And because being disabled is illegal, unlike being a smoker, is a legally protected status under the Federal Fair Housing Act, in which property owners are required to provide reasonable accommodation to allow for that use. But remember, cannabis is still a federally prohibited substance, meaning that a property owner wouldn't be required under the Fair Housing Act, at least, to provide a reasonable accommodation, since as a matter of law, accommodating the use of a federally controlled substance is not considered to be a reasonable accommodation. And the Fair Housing Act explicitly states that a handicap or disability does not include current illegal use of or addiction to a controlled substance as defined in the Federal Controlled Substances Act. So a landlord isn't legally required to find an accommodation, but if a property does have a designated smoking area anyway, that could be one way to provide a place for a resident to smoke or vape medical cannabis. But generally, though, the law still seems to be a bit unsettled as to whether federal law would preempt any state laws that might classify medical use of cannabis in a way that would require a property owner to find a reasonable accommodation under that state's law for medically using cannabis. We will see this issue play out over time, most likely in the courts. But again, property owners do have the legal right to prohibit all smoking and vaping in their buildings. And it's arguably never a reasonable, it's never reasonable to accommodate someone's medical smoking or vaping if that use impacts or affects the rights of others to breathe clean air and to be free of secondhand smoke exposure.
Got it. Okay, we have time for one more question. And how does the implementation of a smoke-free policy work for cooperative housing?
So that's a good question. That's going to be very similar to other owner-occupied communities like condos and townhomes. Adopting a new policy will usually require a change in the bylaws, and then you'll need to follow the cooperative's own process or procedures that are spelled out in their own bylaws or as required under state law. But in general, any new policy is going to, in a cooperative, is going to involve a proposed amendment issued by the co-op board and then followed by notice to the members and then a vote by the members. And that may mean either a simple majority vote or a supermajority vote.
All right, thanks, Marissa. We are close on time here or at time. If you did submit a question in the chat and you included your name, we will have that in our files and we'll try to get back to you via email. So thanks so much for your questions and thanks so much for attending today's presentation. We hope you have a good rest of your day.
Thank you. Bye.